Typhus fever is a serious infectious disease. It is caused by bacteria. These bacteria are spread to humans through insects. These insects include lice, fleas, and mites. Typhus is more common in areas with poor sanitation and overcrowding. This is because these conditions are favorable for insect infestation. Typhus remains a significant public health concern, particularly in developing nations. Typhus fever can cause severe illness. If left untreated, it can be fatal. Understanding the causes, symptoms, and prevention of typhus is crucial. This knowledge empowers individuals to protect themselves and their communities. Global efforts are also underway to control and eliminate typhus. There are three main types of typhus. These are epidemic typhus, endemic typhus, and scrub typhus. Each type is caused by a different species of bacteria. They are also spread by different types of insects. Epidemic typhus is the most severe form. It is spread by body lice. Outbreaks typically occur in crowded and unhygienic conditions. These conditions are often seen during wars and natural disasters. Endemic typhus, also known as murine typhus, is spread by fleas. These fleas usually infect rats. Humans get infected through contact with infected fleas or their droppings. Scrub typhus is found in Southeast Asia, Indonesia, and northern Australia. It is spread by mites that live in vegetation. People become infected through bites from infected mites. The symptoms of typhus fever usually appear within 1 to 2 weeks after being infected. The symptoms can vary slightly depending on the type of typhus. However, there are common symptoms across all types. These include high fever. This is often the first noticeable symptom and can reach up to 104 degrees Fahrenheit or 40 degrees Celsius. Headache. Severe headaches are common and can be debilitating. Rash. A characteristic rash usually appears on the chest and spreads to the limbs. Muscle pain. Patients often experience severe muscle aches and weakness, confusion, and delirium. In severe cases, typhus can affect the central nervous system, leading to confusion, delirium, and even coma. Early diagnosis and treatment are crucial for effectively managing typhus fever. Antibiotics are the primary treatment for all types of typhus. Doxycycline is the antibiotic of choice and is highly effective against all three types. Doxycycline. This antibiotic is typically administered orally for 7 to 10 days and helps to kill the bacteria causing the infection. Chloramphenicol. This is an alternative antibiotic that can be used in cases where doxycycline is not appropriate, such as during pregnancy. It is administered intravenously or orally. Prompt treatment with antibiotics usually leads to a full recovery. Delays in treatment can increase the risk of complications. It can even be fatal, especially in severe cases. Section 5. Prevention is key hygiene, vector control, and repellents. Preventing typhus fever involves a multifaceted approach that targets both personal hygiene and environmental factors. Here are key preventive measures. Personal hygiene. Maintaining good personal hygiene, such as frequent bathing and washing clothes, helps to reduce the risk of infestation by lice and fleas. Vector control. Controlling rodent populations, particularly in urban areas, is essential to minimize the spread of endemic typhus. This can be achieved through proper sanitation and waste management. Insect repellents. Using insect repellents containing DEET can help deter bites from fleas, lice, and mites, particularly in areas where these insects are prevalent. Vaccination. While there is no vaccine currently available for epidemic or endemic typhus, there are vaccines for certain types of scrub typhus, which are recommended for people traveling to or living in high-risk areas. Section 6. Typhus through time. Outbreaks and historical significance. Typhus has a long and devastating history. It has caused widespread epidemics, particularly during times of war and social upheaval. These outbreaks have resulted in significant morbidity and mortality. Ancient times. There is evidence suggesting typhus was present in ancient times, with descriptions of typhus-like illnesses found in historical records. Medieval period. Typhus epidemics ravaged Europe during the Middle Ages. They contributed significantly to the high mortality rates of that era. Overcrowding and poor sanitation in cities facilitated the spread of the disease. Warfare. Typhus has been a constant companion of war. Outbreaks have occurred in numerous conflicts throughout history. These include the 30 Years' War, the Napoleonic Wars, and World War I. The close proximity of soldiers in trenches and camps provided ideal conditions for lice infestation and typhus transmission. Section 7. Diagnosing typhus. Laboratory tests for confirmation. Diagnosing typhus fever typically involves a combination of clinical evaluation and laboratory testing. Doctors consider the patient's symptoms, medical history, and potential exposure to vectors. They then order specific tests to confirm the diagnosis. Asterisk blood tests. Serological tests, such as the Weil-Felix test and ELISA, detect antibodies produced by the body in response to typhus infection. These tests are helpful in confirming the diagnosis. Polymerase chain reaction, or PCR. PCR is a highly sensitive and specific test that can detect the DNA of the bacteria causing typhus in blood or tissue samples. This test is particularly useful in the early stages of the disease. Asterisk skin biopsy. In some cases, a skin biopsy of the rash may be taken and examined under a microscope to look for characteristic changes associated with typhus infection. Section 8. The perils of untreated typhus. Complications and risks. If left untreated, typhus fever can lead to serious complications. These complications can affect various organ systems. They range in severity from mild to life-threatening. The central nervous system can be impacted, with typhus potentially leading to encephalitis, which is inflammation of the brain, meningitis, the inflammation of the membrane surrounding the brain and spinal cord, and even seizures. The respiratory system is also at risk. Pneumonia, a serious lung infection, can develop as a complication of typhus, leading to difficulty breathing and respiratory distress. In the cardiovascular system, typhus can cause myocarditis, which is inflammation of the heart muscle, and pericarditis, inflammation of the sac surrounding the heart. These conditions can impair heart function and lead to heart failure. And let's not forget the kidneys. Kidney failure is a rare but serious complication of typhus. It occurs when the kidneys are unable to filter waste products from the blood effectively. Section 9. Public health measures, surveillance, control, and elimination. Public health authorities worldwide play a crucial role in controlling and preventing typhus outbreaks. They implement various measures to achieve these goals. These measures include surveillance, vector control, and health education. Surveillance is key. Public health agencies monitor typhus cases to identify outbreaks early on and implement control measures promptly. Vector control is another critical strategy. Implementing effective vector control strategies is essential to reduce the transmission of typhus. This includes controlling rodent populations, eliminating breeding sites for insects, and using insecticides to kill vectors. And then there's health education. Educating the public about typhus, its transmission, and prevention methods is crucial to empower individuals to protect themselves and their communities. This includes promoting personal hygiene, encouraging the use of insect repellents, and raising awareness about the importance of seeking medical attention if symptoms develop. Section 10. Research and development towards a typhus-free future. Despite the availability of effective antibiotics, typhus remains a significant public health concern, particularly in resource-limited settings. Ongoing research and development efforts focus on developing new tools to prevent and control typhus. Vaccine development is a major area of focus. Researchers are actively working on developing vaccines for all types of typhus. A vaccine would be a significant breakthrough in preventing the disease and reducing its global burden. Improved diagnostics are also crucial. Developing rapid and accurate diagnostic tests is essential for the early detection and treatment of typhus, particularly in remote areas with limited access to healthcare. And of course, new drugs and therapies are being explored. Research is ongoing to develop new drugs and therapies for typhus. This includes exploring alternative antibiotics and developing treatments to address the complications associated with the disease. Section 11. Conclusion. Staying informed and vigilant against typhus. Typhus fever, a potentially life-threatening disease, continues to pose a risk in many parts of the world. By understanding the causes, symptoms, and prevention methods, individuals can take proactive steps to protect themselves and their communities. Public health measures, including surveillance, vector control, and health education, are crucial to controlling and eliminating typhus. Ongoing research and development efforts offer hope for new tools and strategies to combat this ancient disease. By staying informed and remaining vigilant, we can work towards a future free from the threat of typhus fever.